What if I told you that osteoarthritis is not just a condition of wear and tear? Yes, the common misconception is that osteoarthritis is solely a result of our joints aging and wearing down over time. However, this is only a part of a much larger picture. Osteoarthritis is in fact a disabling joint disease that involves the degeneration of the joint complex. This includes the articular cartilage, subchondral bone, and synovium. It's true that this condition often affects weight-bearing joints and those that are heavily used, such as the hip, knee, hands, and vertebrae. But it's essential to understand that there's much more to it than just advanced age and overuse. Research has shown that osteoarthritis can have various causes. These include pre-existing joint abnormalities, genetics, local inflammation, mechanical forces, and biochemical processes. These processes are often promoted by pro-inflammatory mediators and proteases. Now let's talk about risk factors. Advanced age, obesity, previous injuries, and asymmetrically stressed joints are among the major risk factors for osteoarthritis. So what are the symptoms of osteoarthritis? In its early stages, patients typically report a reduced range of motion, joint stiffness, and pain that is aggravated with heavy use. As the disease advances, persistent pain may also be present during the night and/or at rest. How is osteoarthritis diagnosed, you might ask? The diagnosis is predominantly based on clinical features and supported by radiological findings. But remember, classic radiographic features of osteoarthritis do not always correlate with the patient's clinical symptoms or appearance. The management of active osteoarthritis typically involves lifestyle changes, such as moderate exercise and weight loss. If these measures don't improve symptoms, pharmacotherapy is often used. In cases where these measures do not improve the patient's quality of life, surgical procedures such as arthroplasty may be necessary. To summarize, osteoarthritis is a complex joint disease with various causes, not limited to aging and overuse. It affects major joints and presents symptoms such as reduced motion, stiffness, and pain. Major risk factors include advanced age, obesity, previous injuries, and asymmetrically stressed joints. Diagnosis relies on clinical and radiological findings, and management involves lifestyle changes, medication, and possibly surgery. So, the next time you hear someone say osteoarthritis is just a result of wear and tear, remember, it's a lot more complicated than that. And understanding these complexities is the first step towards effective management and treatment.